I'm John Shaw, the director of the Paul Simon Public Policy Institute. This is Representative Lindsey LaPointe, who is joining us from the 19th House District, which we will hear more about her district and her work. Let me just tell you just a word about the series. It's called Pizza and Politics. It's been going for some time, preceded me. But it's been, the notion is to have sort of an informal conversation where rising stars in Illinois politics can come and talk about what they're working on and kind of give you a chance to learn about some of the issues that are happening, in this case in Springfield. I will say one of the first events that I hosted as director, I had met the chairman of the House Education Committee. And so we'd had a good conversation. I said, well, and I guess I'd met him in August. I said, would you mind coming down, early next year for our Pizza and Politics? He said, oh, I'd love to. So it was you wake up February, and it was like early February, and I wake up into a heavy snowstorm. I'm thinking, oh my God, that's what the thing you fear about winter events, days like this. And I knew he was coming from Chicago, so we called him and said, look, if you need to cancel, we fully understand. He said, no, I'm coming. And he powered his way through. He listened to the Hamilton soundtrack all the way down the state of Illinois. His name was Chris Welch. He later became speaker. So I'm not suggesting causation, but people who come to the Institute are folks that we think are doing really important work. So the format, I'm gonna just chat with the representative for about 20 minutes, half hour, asking some broad questions about her work, her career, her background. And then we wanna open it up to you and have a very full conversation in which you get a sense of the issues she's working on, the issues that are unfolding now in Springfield. We're kind of in crunch time for the legislative session and all. So Lindsey, starting from kind of the beginning, how did you get involved in politics? What was was this something as a youngster? It was something that always seemed like it would be intriguing. And then maybe kind of segue into, you went to Grinnell College as an undergrad and how you sort of developed your interests there.
Great question to start it off. And I actually never pictured myself going into quote unquote politics. And I really think in our culture that's turned into somewhat of a dirty word too. I tend to use the term elected official or public servant, but never picture myself in politics, especially in Chicago, Cook County in Illinois. And we know that we don't have the best reputation for all politicians behaving well. And that was always in my head, that I don't know who to trust in politics, and therefore I didn't really want to get involved because I was too apprehensive about actually getting involved with the wrong person, which is a fairly legitimate thing to think about in Chicago and Cook County. But I was a social worker, and I was in the world of human services, and I absolutely loved that work. And I think back to my first job after Grinnell College, and I was at a group home for kids with special needs, just jumping right into the fray. And then I went on to work with the homeless and work with seniors on fixed incomes and work in childcare assistance, and I absolutely loved all that work. But as you might imagine, I was really up close to people that were suffering, people that were in a lot of pain. I was up close to a lot of systemic barriers that had to do with funding or had to do with policy and how we make it and how we implement it. And so it was that on the ground work in social work, working with many of our most vulnerable, that made me want to go into policy first. And I'm a social worker, I'm also a policy nerd. And so really that was my draw, to go into public policy. And I ended up getting my master's in social work at the University of Illinois at Chicago, and then transitioning in my late 20s, early 30s into policy. Kind of a bumpy road to make that jump if you are coming from the background of on-the-ground human services. But once I was doing that work, and I happened to be working in criminal justice reform and creating more rehabilitative options for people dealing with mental health and substance use that were also in the criminal justice system, I began to get up close to the General Assembly. And I realized that the decisions that are made in the Illinois General Assembly are on the issues that I cared about the most: public education, public safety, human services. And this was around when I first started kind of thinking about this in my early policy career, maybe 2014, 2015. And I'm going to be honest also, I was paying attention to who was in the General Assembly and the quality of their work and how informed they were. And I wasn't that jazzed about it. And I thought to myself, I think I could do this better. And so that, it was really motivating. My big inspiration was wanting to, it sounds so nerdy, right? Because I'm a policy nerd, but wanting to make big systemic change for people that are most hurting in this world. And that's a direct function of me coming from the world of social work and bringing that ethos with me.
No, you came to the General Assembly through an appointed position. Tell us a little bit about the backstory there. I mean, that's sort of an unusual way to enter the General Assembly, isn't it?
It is, yeah. And it's probably folks who aren't from Chicago or Cook County are like, what in the heck? How do you end up here if you weren't elected? So how we handle vacancies, if somebody leaves office to go to another job, or they just want to retire and they do that midstream, this is certainly how it works in Cook County, and it's a function of the Democratic Party in Cook County. There's an appointment process where if there's a vacancy, you can make it known that you are interested in being considered, and all of the local Democratic committee people that share geography with, in my case, with that House district, they all have a weighted vote to vote on the appointment. And the vote is weighted on how many voters turned out, Democratic voters turned out in the last election, because this was a Democratic Party function. So how did I even get there? How was my name in the mix? Because it's usually not somebody completely random. So I hadn't done anything in politics in Chicago until very late 2014, because I had always felt intimidated, frankly. Didn't want to get wrapped up with the wrong person. And in very late 2014 in Chicago, Chuy Garcia, who's now a congressperson from Chicago, threw his hat in the ring to run for mayor against Rahm Emanuel. And this was going to be Rahm Emanuel's second term. And I had known Chuy. I actually had played in a softball league with him in Chicago, because Chicago's not that big of a city. It's like, it feels like a small town in many ways. And when I had met Chuy, he was not in elected office at that time. He was running a nonprofit, anti-violence nonprofit. And I didn't know about his background. I didn't know he was a state senator and an alderman in the 80s. He just seemed like a regular guy to me. So when I learned he was running for mayor, he was so human to me, and I didn't like what current Mayor Rahm Emanuel was doing for the city, so that was my inspirational moment where I thought to myself, I keep reading the news every day, I'm doing my policy work, I'm frustrated, I've never been involved in politics, but some guy I know who's really down to earth is running for mayor. I Googled, where's the closest campaign office to my house? I just walked in and started volunteering every week. My candidate didn't win, but it was a really foundational experience for me, and it took away the intimidation of Chicago politics. And after that, I started looking around for other candidates I believed in and stayed as a volunteer. And then I joined my local political organization, ended up being the vice president. And so I was in this situation where my policy career was progressing at the same time that I was getting very involved in my hyper-local neighborhood politics with people that I did trust. And so when the vacancy popped up and I thought to myself, why not me? Why not now? Why not somebody with a social work background? I think I have things to bring to the table. I put my hat in the ring and they strongly considered me, and I got appointed in late July 2019. So it's been almost 6 years.
Wow. Well, tell us about the 19th district. What is it like?
That's an important question, because a lot of times people overlook what is the actual community that elected officials represent. And that's the core of what we do. Representation is a verb. It should matter who lives in your district. So the 19th House District is the far northwest side of the city of Chicago. And then I have about 1,200 people in the village of Harwood Heights, which is right over the border of the city. And it's 108,000 people, and every House district has about that amount of people. And the 19th House district is terrific. It's awesome. Like many parts of the city, it is in some state of change. It is an area that has lots of public sector workers, so lots of current and retired police, fire, teachers, a lot of people in government jobs. It's an area that is historically white, and if you know anything about the history of Chicago politics, it would have been called, oh, it's where the white ethnics live in Chicago speak. But things have changed, and there is definitely a population of older folks that as they move out, they sell their houses. We have a not insignificant Latino population in the 19th House District, about 22%. There's also a growing Arab American population. And then there's a lot of people in my demographic too, and those are folks in their 30s and 40s who didn't grow up in that area, but they moved from another part of the city. They moved from a more expensive part of the city to a more affordable part of the city to buy a house that was relatively affordable and to access relatively good public schools. And so it's a very interesting mix. It's definitely a Democratic district, but it's all relative. And I would say there's purple pockets, and I'm very aware of that. And I'm a Democrat, but because it's me, it's my ethos, and part of that's my social work background, I work really hard to listen to everybody and to really show up at everything I can. And I think in this hyper divisive, hyper political moment, that's even more important. It's harder to do, but I make it a point to keep an open door. And even when people are maybe come at me in a threatening way, just verbally, my instinct is to always be like, let's talk about it. Like, I want to hear your point of view. Of course, I'll meet with everybody. And even just taking that approach can really take the temperature down and just give people the ability to feel heard, even if they have political leanings that are very different from mine. I still want to make sure that I'm in conversation with every person of that 108,000 district that I represent.
Well, I was looking at your newsletter, and I was struck by just the variety of kind of connection points. I mean, you have references to a warming center. You talk about a women's empowerment yoga class, a lot of public safety updates, a primer on if people are detained on immigration issues, what their basic rights are. There was even a little brochure on furnace assistance. So it seems like a big part of this job, I mean, you mentioned representing, is just letting everyone know about the services that are out there. And you get a sense, just looking at your newsletter, what a patchwork it is. I mean, there's a lot of services. Unfortunately, they're not always well connected, which I'm sure has been sort of a theme of your professional career to try to connect these. But just sort of talk about maybe your role as, I want to switch to Springfield in a second, but your role as just kind of a community outreach person.
Absolutely. And that's a part of being a state rep for sure, but arguably any elected official at any level of government that we don't talk about enough. And me and my office, we do it in our own way. We have our own ethos, but we call it the community outreach part of our job. And I think about us being a state rep in three ways. There's the legislative part, which everyone thinks about. There's also the community outreach component, and then there's what we call constituent service component, which those can be intertwined with community outreach. So to me, and everything you just mentioned is part of community outreach and constituent services, the outreach component is our way of showing up in the community and being as accessible as we can be, and using that as a really important pathway to both listen to the people we represent and get to know them and hear what's going on the ground, but also to educate them on not just what we're doing in Springfield, but what are all the community resources out there that we have to help build strong families and neighborhoods and our city. What's going well, what's not going well. So that community outreach component is so important to me. And again, at this moment in time where there are some real questions about where to go for credible information, I work really hard, and I tell this to my team, to be a credible source of information, even if it's as simple as, well, where might we get assistance for heating, or what's going on with this lawsuit with our attorney general and the federal government, for example. If we're going to put something in writing, I think you've got to look at it 3 times and make sure you're confident in it. And I want the people that I represent to see me and our office as a place where you can go get credible information, because there's too many places to get non-credible information right now.
Well, let's talk about your weekly routine when the General Assembly is in session. I know right now, between now and the end of May, it's a hyper busy time. So, say from January to May when the session is going, do you typically go down to Springfield sort of on a Monday morning and then come back Thursday night? I mean, how is your life organized? And then busy weekends with constituent work. I mean, what does a week in your life look like?
Right now, really busy. And for me, this is my only job, where that's not the case for all legislators, because everyone has to make a decision that's right for them and their family. So I generally drive down from Chicago to Springfield on a Monday night. I prefer to just get there the night before and get settled. And then I'll have a few in-person or virtual meetings on a Tuesday morning before we go to the floor to go into session. And then we generally are on the floor Tuesday afternoons. The House Democrats are starting to have our regular caucus meeting, which is an internal thing that we do that we can hash a lot of things out. We learn what's going to happen for the week. We have internal debates that sometimes are better to have behind closed doors, and just to really feel out where our colleagues stand on things. And then just in terms of a typical day in Springfield, we would have committee hearings in the afternoon, and then people go to some receptions. There's always stakeholders in town who are using this as an opportunity to talk to lots of legislators at once. And then me being me, I might go to dinner, and then I get home at 9 and start working again for a few more hours.
I want to talk about a couple of the issues that you're involved in, but I also want to talk for a second about your Michael Madigan moment. Well, early in your career, Madigan, of course, the longstanding House Speaker, a number of Democrats were starting to decide with his legal issues that it was time for new leadership. And I think actually the first time we met, you were mentioning the story about this was coming to a head, and you knew a phone call was going to be coming your way that was probably not going to be the most pleasant phone call you've ever had. Talk about and even that moment, because I think a lot of people, as they think about their careers, it's like sometimes these moments come when you need to either take a deep breath and say, I'm not with you, or you play along. So,
yeah, that is so true. And oftentimes we don't, in our personal lives and our professional lives, sometimes you don't know how big a moment was until you're looking back on it later. And this was definitely one of those moments for me. And after almost 6 years, when I think about what I've done that is most consequential, and people tend to ask you that, right? This is one of them, no doubt. Like, taking that hard stand as a Democrat to say to your own speaker, I think you should resign, is a very tough thing, especially when there's a lot of pressure to not do that from various stakeholders. So for me, this was late summer of 2020. It was COVID. I had only been a rep for a year, which frankly made it a little easier for me than other people who had a long-standing relationship with former Speaker Mike Madigan. We had a bunch of news coming out that summer about ComEd and a deferred prosecution agreement. And we didn't know then what we know now. Like now we're in a world where Mike Madigan has been convicted but not yet sentenced. So what was clear to me was that a huge thread in government and politics in Chicago, Cook County, and Illinois is a lack of trust. And that still is so pervasive. People do not trust elected officials. And to me, it's going around door to door campaigning, it was so clear that the speaker at the time, Mike Madigan, was a face of that. He was a very important face of that distrust. Now, a lot of that was due to our former governor, Bruce Rauner, going at it and throwing a bunch of, millions of dollars to vilify Mike Madigan. That is true, no doubt. But also, the ComEd stuff was coming out, and his name was in the mix. And to me, at the time, we were gearing up to have the constitutional amendment to create a progressive income tax system instead of a flat tax on the ballot. And I just thought to myself, I don't think we're going to win that because nobody trusts us. And people are pegging this on the ballot with Mike Madigan. It was all wrapped up. And the other thing I think about is just how, in terms of leadership, where people hang on for too long, there's other people that are capable of filling those roles. I'm not the only one that can do this job. You're not the only one that can do that job. No one has to be speaker for 36 years. That's just too long, in my opinion. And so Mike Madigan had heard that there were some of his House Democrats that were calling for him to resign or thinking about it. So he was making calls to every single House Democrat to say, are you with me or are you against me? And thankfully, I got the heads up that he was making these calls because it allowed me to prepare myself. And that's when I realized, I know how I really feel about this. I also know how my constituents feel about this. It was a private phone call, but this is my decision point. Because once I say it out loud, even if it's not public, I can't go back on it. And then it did become public. And 19 of us House Democrats ended up saying publicly that we think he should resign, and we stuck together. And just in terms of the math of him needing the votes to be reelected speaker again, if 5 of us had defected and said, no, we actually are going to vote for him, he could have maintained. So we stuck together. And I do think still that it's one of the most consequential things that I've done as a state rep.
When the phone call ended, was it taking a deep breath and it's like, well, I've made my bed and it's what I need to do and we'll just see what happens?
Yeah, I did need to take a deep breath, and there were a lot of unknowns. And I was looking back, I was so new. I had only been in a year. And it was just an unknown, right? Like, I didn't know what all the consequences would be. And I certainly had no idea that we would play a role in him stepping down. To me, it was, and I think I was the 6th House Democrat to be public about this, so 6 out of 9 eventually. I mean, I didn't think it would actually result in him stepping down, but I knew I still had to do it and say it. So it's just a lot of unknowns.
Well, let's talk about the legislation you're involved in. You chair the Mental Health and Addiction Committee, and I know you're really interested in mental health access legislation. Talk about that passion and particularly what your committee, how it works, and what you're working on now.
I'm so glad that I get to be chair of the Mental Health and Addiction Committee, and I will tell you that being a little more senior and being almost 6 years in and getting to chair a committee has really changed the scope of my job in a way that is a great fit for me. And as you're out and about meeting your own legislators or other legislators, some of us get to specialize and some of us are a little more generalist in the work that we do. So as a social worker, and now I am a licensed social worker, it's an incredible fit. And given that I'm also a policy nerd, I feel very strongly, as do many other people, that affordable and accessible behavioral health support is a top priority. And just for context, when I say behavioral health, that means mental health, addiction, recovery, trauma support. This issue is so front and center at this moment. And I think it's front and center because needs are higher than they've ever been and stigma is down. So never before have people been so willing to seek the support that they've needed for a long time. And young people have played a very big role in destigmatizing behavioral health. So that's the North Star. How do we get access? Like many issues, it actually gets really complicated really fast. And when it comes to behavioral health, we have Medicaid, which is it can be a very complicated issue. And it's a joint, as many of you know, I'm sure, it's a joint federal and state program and funding stream. Medicaid is actually the biggest funder of behavioral health in the state of Illinois. And so I do a lot of Medicaid work, and how do we get more behavioral health when it comes to Medicaid? We have to raise reimbursement rates, which is a state function. So a lot of my work is trying to find the money and make sure that our behavioral health professionals who are taking Medicaid are reimbursed in a way that better covers the cost of care, because right now it doesn't cover the cost of care. Building the workforce in behavioral health. We have a shortage, and the state has recognized that. Our governor has recognized that and has created a behavioral health care workforce center that's a partnership between the SIU School of Medicine and the Jane Addams College of Social Work. And so we are pushing policies for recruitment and retention and also paying behavioral health professionals more. And there's a direct connection between reimbursement rates from Medicaid or from commercial insurance, like Blue Cross Blue Shield or Aetna, and how much professionals are getting compensated. So that's a huge deal. And then another really important thing is mental health access in schools, because that is where all young people go unless you're being homeschooled. And we have not done a good job over the years here in Illinois. School social workers in Illinois, first of all, there's a shortage. And in most school districts, school social workers only work with kids with IEPs who are special education. Well, other kids have needs too, but we are so far from having the people on the ground in schools that we need. So we are working on a bill right now that would move us towards universal mental health screenings in schools. Families would be able to opt out because that's important, but we want it to be more uniform across Illinois. And then another thing related to mental health and education that's really important to any higher education institution that's public is a few years ago, through something called the Mental Health Early Action on Campus Act, we started sending state dollars to public higher education institutions, 4 years, and community colleges. So we send about $13 million a year. So community colleges and places like SIU can have some state funding to build up wellness support right here on campus, to meet people where they're at a critical moment in their lives to help them navigate mental health and wellness needs. We should be funding it at $23 million, just to be clear, but we're funding it at 13 right now.
I have one more question, then I'm going to turn it over to you. And that is, I mean, we follow Springfield from a distance here. I know you're in the final weeks of the General Assembly. I mean, the budget is always sort of a huge kind of macro issue. What are the other big issues that people should be paying attention to? And then what are some of the smaller, quote, smaller issues that maybe some things are happening positively that we don't always read about?
Yeah, so the budget is going to take up a lot of our time in May. One of the biggest issues facing Illinois and many other states at this moment that's directly connected to the budget is the instability coming out of DC and the instability of federal funding at this moment. It's very difficult to craft a state budget when we have federal funding streams being paused, frozen, or taken away midstream. And so this is going to be a unique budget year. The word that I use when I think about the state fiscal year 26 budget and what we have to do in the next 5 weeks or 4 weeks is unsettled. And we're not going to know exactly what is happening in DC by May 31st. So our minds are all open to the fact that we might have to come back for a special session in the late summer or fall once we have more information about the stability or instability of federal funding. Another really big issue, and I'd be curious if this is percolating down here in Southern Illinois, but we need to better fund and also reform our public transit system in Illinois. It is all over the Chicagoland area media. We have some major transit systems. We have the Chicago Transit Authority, the Regional Transit Authority, Pace Bus, Metra. They're not really coordinated. And the service is not, I'm being very diplomatic here, it's not high quality at this moment in time. And we all know what happened to public transit during the pandemic. Obviously, ridership plunged, quality plunged. Transit was running on COVID relief dollars. And so the budget is huge. Transit is huge. Figuring out how we're going to keep things together as federal COVID relief dollars go away. And they're truly, some of them have already gone away, but in the next year, really, they'll go away. Other big issues are related to our Tier 2 pension system. You can't be a legislator with not knowing about the multiple tiers of our pension system and not knowing about our $140 billion of pension debt, because we have we have a pension deficit problem in Illinois. So, that is a pervasive problem. And then also this spring, there is a push to make our Tier 2 pension system more adequate and bring it more in line with Tier 1. It is nowhere near settled. And it will cost a fair amount of money. So that's another really big thing on our radar. Public education funding is always front and center. K through 12 education in particular, in 2017, we created this evidence-based funding formula where we were on track to put in $350 million to our K through 12 schools every year. We missed 1 year in 2020, but according to the formula, so many of our schools are not on track to be adequately funded. And then just one more thing about that, because it's very relevant to four-year higher ed. The higher education system, the public system, we now have a bill and policy development happening to create a funding formula for higher ed. Will that pass this spring? Some people in this room would have something to say about that, I'm sure. The honest answer is we don't know. It's gaining traction. We're all being educated. I recently learned that the way the bill is written, and this is important, I always have to ask this as a legislator, would require about $135 million a year. So that's another thing that even if we don't get it done this May, we have to stay focused on that to create far more adequate funding for our public schools in Illinois, kindergarten all the way through higher education.
And there's also a bill related to community colleges giving four-year degrees that I know.
Yes, there is.
You have heard probably a fair amount about.
Yeah, there's a lot going on in the higher education space this spring. And it's so important to our entire state, no doubt. We want our folks, our young people, our people of all ages who go through our higher education system to stay in Illinois. At least I do. And we need to make sure that strong opportunities for a really robust higher ed experience exist in Illinois.
Great. Turning over to you, let's get some questions from the audience. Sure, and we'll pass it around.
Well, as a social worker, I would like to ask how have been the experience to bring the social work point of view to the political discussions. I know there's like a misunderstanding about how people think social work is or applies about the individual attention or work with individuals, but when you are in this area, like thinking about the population in general, how have you this connection?
The disconnection of what people think social work is that?
So I would like to know from your experience, how can you bring the social work point of view to the political discussions that sometimes is thinking
I
like
see, yeah.
management, like something that people think that is far away from social work.
Yeah, no, that's a really good question. And I feel like I live out the answer every day. And my 2-person team up in Chicago, they're not social workers, but they kind of are now. Because this is how we do our work every day. And I think what I don't want is people to hear, oh, a social worker legislator, and to think the only thing it shapes is the issues I work on, because it's not just the issues, it's an approach. So one key example is always thinking about whose voice is not being heard. And all too often we don't bring the right people to be around the table. So making sure that the people that are most affected by whatever policy that it is has a seat at the table. And that might be actually in a meeting, a seat at the table, or it might mean me getting on the phone and calling and saying, well, what do you think about this? Like, I really need to know your opinion. Social work is really, again, this is going to sound kind of nerdy here, but you'll identify with what I'm saying. It's really about systems thinking, and social workers see the world as different systems. And we have micro social work, which is one-on-one. We have meso social work, which is sort of neighborhood and community level. And then macro are the big policies that I'm working on in Springfield. And so I'm constantly thinking about all of the policy issues through all those lenses. How will this play out in somebody's family if we do this? How is this going to play out in a neighborhood? And let's talk to people to get their point of view. And what I frequently say in meetings, especially when they're about human services, is pretend I'm the person on the ground trying to access this service. What does it look like for me? Walk me through it. So I think a key thing that social work brings to government and politics is we're not just thinking about passing the policy. We're constantly thinking about, how is this actually going to be implemented? How is this going to affect people's lives on the ground? And we have to think like that. All too often, I think elected officials and policymakers don't. And then it doesn't work for people. And then we do constantly go back to the drawing board. But too much is at stake not to think things through 10 steps and to really understand how it'll affect people.
So Illinois has one of the most unique political climates, I would argue, in the country. So how do you, as a legislator from Chicago, work with Southern Illinois and downstate with people who feel constantly like they are in a battle with Chicago and Chicago politics, which, I mean, obviously we know how that really looks, but their perception of being against Chicago from Southern Illinois, how does that affect the way you introduce policy?
That's a really good question, and thank you for bringing that up. To me, the most important thing is to not make assumptions about people and to be curious. And everything you just said has existed in Illinois for a long time. I feel because of who's president, things are even more intense and divided. And so I feel a responsibility to bridge more than maybe I did 3 years ago. And so just engaging people and asking them what are their points of view, asking them, what's your district like? What are the 108,000 people that you represent? What matters the most to them? Just something as simple as having ongoing open conversations with my Republican colleagues who represent big geographies in Illinois that are obviously, they elected a Republican, that are far more Republican than Democrat, coming to the table and keeping the conversation open. And I will tell you that because Democrats have a super majority in the General Assembly, like it would be easy not to do that. And that would be harmful. And it even happens in my committee. Every committee has a minority spokesperson. So for the mental health committee, it's minority spokesperson Jackie Haas, who's from Kankakee. Well, Jackie also is a licensed clinical social worker. And so I make it a point, and we have folks from Southern Illinois on that committee, to Dave Severin, who represents close to this area, who I ran into yesterday, by the way, at a grocery store. I don't just go into the committee without talking first with them and feeling them out. How do you feel about this bill? What do you think your questions are going to be? And I can tell that me doing that is so well received that it actually makes me think like, wow, people really haven't done this in the past. We can't just jam things through without having those conversations. And then we find that in many ways, we're not that far apart. And oftentimes like some of the fighting that we all do, like sometimes that's actually for show. And it doesn't actually represent true disagreement. And it's kind of the weird thing about politics. Some of it is performative. I don't really like that part of politics, but people have to do stuff for the media to signal to the people that they represent that they are fighting for them and going to work every day and representing them. And that's one way to do that. There's many ways to do it, but that's part of it.
Hi, my name is Giovanna Fawcett, and I will be graduating Saturday with my master's in human sciences with a certificate in gerontology. And I say all of that, I had the pleasure of being under the advisement of Dr. Baker in the policy part of my journey. So for me, I'm a big advocate for seasoned citizens. And I know you probably can't answer this question because you mentioned that you guys will probably have to come back for a special session. But with all the cuts coming from federal, they most of the times they affect the seniors, especially the ones who are Medicaid, the ones who are in senior facilities. What are you guys doing to fight for them?
Yeah, that's such an important question. And I think how I feel kind of about human services writ large is unless you're in it, unless you're working in it, unless your family has had a need, which to be clear, many families have, you don't understand how hard it is to get consistent services. I was at a meeting earlier today and I said, most of our human service system operates on a wait list basis. And I don't think most people realize that. And it's really because of a history of underfunding. We provide just enough to set something up. And we have a 5-year wait list for people with severe developmental disabilities. It's called the PUNS list, 5 years. And we're under a consent decree. It used to be like more than that, and we've shrunk it to 5 years. So for our senior population in particular, Medicaid is the biggest funder of long-term care in Illinois. And so you probably already know this, but making sure we are protecting Medicaid and connecting the dots for people, and to educate people on how woven it is into our long-term care system is a part of our advocacy and what we're doing. the fragility of Medicaid at this moment, and I do think people have been making their voices heard. There's been a lot of good education, so I feel better about what might happen now than I did 2 months ago, because there's been some tremendous advocacy and education. But not only is it puts a lot at risk on a human level, it also has grave consequences for the state budget of every single state in this nation. So we're going to continue to advocate to make sure that we have the funding streams that we need to support our senior population. A huge component of that is to make sure we are adequately funding systems and programs so seniors can stay in their homes as long as possible. And part of that is supporting our in-home care workforce. And every year we advocate to try to push their wages up a little bit. And this is the same thing we see in the behavioral health professions and all the human services, especially as minimum wage in Illinois has gone up, which I supported. I'm glad that we just capped out at $15 an hour. It has created pressure on our human service workforce and wage system, because now people are leaving home care and senior care and leaving nursing home jobs because they can go work in retail and earn more as the minimum wage has been pushed up, or earn just the same and have a job that is far less stressful. So thank you for choosing that field. We desperately need you. I hope you stay in Illinois. And I see my charge as making sure that we have an array of services so people can stay in their homes and then have adequate long-term care, and that the professionals in the field can stay in the field for a long time and be adequately compensated.
Well, actually, I'm going into elder law here.
Awesome. So law and policy to make that all happen.
Yes,
Great.
so, whether I'll be in Illinois, I would like to stay, this is home, but I just have to go, where opportunity takes me. But ultimately,
Excellent. Well, we do need you here.
thank you, and keep doing what you do.
Thank you.
What percentage is of Medicaid comes from
Like on average, it's like 65%. And for many, for a lot of Medicaid, we get a 50% match. So it's about 50%. But there are certain populations, a population called the Affordable Care Act expansion population, that we actually get a 90% match. So when you kind of do the average of everything, it's about 65% at this moment.
Yeah, I guess my concern to follow up on that is when you take a massive program like Medicare, has the General Assembly begun to be planning for what could be the doomsday scenario where this federal money doesn't come to Illinois?
And Medicaid, right? Is that what you said?
Well, Medicaid, and there's all kinds of other programs too, but that's probably the largest with the most federal funds.
Yeah, yep. Yes.
And if so, what?
A thing that we've spent a lot of time on is really getting very precise about how much comes to Illinois for which populations. And I can tell you that there's about $21 billion for Medicaid that comes to Illinois every year. And for the ACA expansion population, which are single adults that weren't covered until we had a Medicaid waiver in Illinois and had the ACA. Even if just that population was made ineligible, Illinois would lose $7.4 billion a year. So we're taking stock of all of that. And part of the answer to your question is going to play out as we do the budget in the next 4 or 5 weeks. And the governor has said publicly, and we're all now, it's on our radar, is we do have to be ready to come back if necessary. It's hard for me to super answer your question, because part of it is like, it is impossible. It is impossible to fill a state budget gap if Medicaid were completely stripped away. and this is not just Illinois, it's going to be every state. What we can do is take stock of exactly what we have that is funded by Medicaid, and to keep this all in mind as we pass the state budget in May, but with the recognition that we might have to come back. So I don't have a great answer to your question, because states are going to be put in an untenable situation if that actually happens. But the advocacy that's been happening and the education has been really key. And we have heard from some GOP congressmen that, like, okay, we understand we're not going to cut the whole thing. We're not, like, there's been some conversations about shrinking a subset of Medicaid, and for some of us that's not ideal, but the fact that we've done some really good education and people are understanding the program more is very important.
Can I follow up, second question, political orientated?
Sure.
Who's gonna run for Senator Durbin's seat? On both sides, if you know.
Yeah, well, I'll offer what I know in terms of what's in the mix, and I can speak more about Democrats, of course. I mean, we know Lieutenant Governor Juliana Stratton is in the race. She was clearly ready right when Durbin declared he wasn't running. I mean, the people that have signaled that they are seriously thinking about it are Congressman Raja Krishnamurthy, who's the northwest burbs of Chicago. If you read the political news, you know he's got about $19 million in his campaign account. So it's more than anyone else has, except for the governor. And we know that Congresswoman Robin Kelly, who represents the parts of the south side of Chicago, south suburbs, and she goes all the way down to Danville. So that's kind of an interesting mix of people that she represents. She is seriously thinking about it. So you might see her get into the race. And then Congresswoman Lauren Underwood, who's from the far western suburbs and even some rural areas, who hasn't been in that long. I think she's been in maybe 8 years, 7 years. She's seriously thinking about it. And then we've heard State Treasurer Michael Frericks thinking about it a little bit. I can give you the best intel about the Democrats. The GOP, I'm not really sure. I think we've heard that Darren LaHood might be thinking about this, but that's what I got. I will say that I guarantee you this, more people are getting into the race this week. That is what my intuition tells me, and they have to, right? If we want this to be a competitive primary, time in a campaign is the most important currency. And our LG got a jump start, and if people want to run, they got to get in.
I might just say, as telling a student, I remember just the last couple cycles. I remember Barack Obama in 2004. I mean, he was running a distant third through much of the primary season, and then the front runner stumbled, and then he was able to win the primary, and then the world changed. And even Carol Moseley Braun, when she was challenging Alan Dixon, was a distant third for a lot of the primary season, and number one and number two were beating each other up, and so she snuck in. So, you know, even in a crowded race like this, I mean, winning 27, 28, 29% of the vote can win. So a lot of people think, if I can hang around, you know, there's a shot at it.
That's so true, right? If there's multiple people in the race, it makes it more open, and it makes it so somebody who you don't think can just pull it off. The one thing I want to add about this, which speaks to another question, is I think primaries are really healthy, and we haven't really had, obviously not for Durbin's seat, we haven't had a primary for a statewide Senate race in a really long time. And
2004 was the big one.
there you go.
Lots of Democrats.
Like, this is really important, and it's important for all those candidates to get around to every corner of the state and really listen. And for the Congress people that are going to run, I wish that, like, it would, that's going to make them a better congressperson. Unfortunately, they're not going to be able to run for Congress if they run for Senate too. But it's just so important. Campaigns can be glitzy and glamorous and hard, but at the end of the day, I feel that they should be about listening. And so there's a big opportunity, and I do hope more people get into the race.
I think the problem with that is that what we saw happen with other elections where the people that may be similar to each other but might be the best choices take one, and then somebody who, like our current president, who came in as an unknown but nobody dropped out. So you just kept going and going and going with everybody staying in until the last minute, and you've seen that happen in other primaries as well. So I think it may be good at the beginning, but if everybody has the ego that they're gonna stay in, it may be the least best person that ends up winning the race.
Mm-hmm.
So I don't know how that adjusts, but maybe egos.
And people, we don't see this a lot, but people can start and then they can bow out, and sometimes that can really give another candidate momentum.
We saw that with Paul Simon. Paul Simon ran. He made a decision. I'm splitting votes from good people. So
It's a really hard and noble thing to do. And it does involve ego.
Well, I have one final question for you, which is maybe is to wrap up, which is, as you think about your work and your career, I mean, what is the best part of the job and what is the most frustrating, the part that is the hardest for you as you go about your day-to-day work?
The best part of the job is, it might sound generic, but being able to solve problems. And we can often solve one-on-one constituent problems quickly because we are our constituents' advocate in state government. So if they are hitting a barrier, there are liaisons at every state agency where we can pick up the phone and call. And oftentimes it works and we can resolve a problem in the moment. And it's that same thing on a much bigger scale that is the most meaningful part of the job for me, to be able to recognize a problem that is really affecting people's lives and then to be able to craft legislation and introduce it and do the debate and count the votes and pass it, and then hold what is often state agencies accountable to actually implementing it. That's the best part of the job for me. And just to give you one quick example, I won't go into too much detail, but we passed a bill in Illinois in 2023 to make it easier for people to become licensed clinical social workers. And what we did has resulted in 550 LCSWs in Illinois in calendar year 24 who are out there providing life-saving social work services and therapy to people. And so that's not a huge bill that would be in bright lights, but for me, it's an emblem of my favorite part of the job, being able to actually make real change that helps people in their lives.
I'm assuming fundraising is maybe one of the least interesting parts of the job.
That is definitely true. And in Congress and in the Illinois House, we actually run for office every other year. And because it starts with petitions, if you think about every 24-month period, there's only about 9 or 10 months that we're not running. And raising money is not the funnest thing, especially when you come from my world and you know that there are real needs on the ground. I'd rather raise money and give it to a homeless shelter than spend it on political mail.
Great. Well, Lindsey, thank you so much for this really wide-ranging and interesting discussion. I know you have a meeting in a few minutes, but as you're walking out, I'm sure if students want to grab you to ask a question or two, you'll have a second to do it. Don't forget to grab some pizza. We don't want to have our speakers deprived of some nourishment. But thank you so much. And also, of course, for coming all the way down. I mean, it's a long, long trip, and we really are grateful that you've taken time from your busy schedule to come down. And none of your voters are here, but hopefully we're recording this, so they will be fully aware that you're down here defending their interests and also looking at problems from the perspective of all of Illinois. So thank you so much for being here. We really
Thank you. Thank you.